Yep, a little bit there. Oh God, here too. Geez, this is unflattering. All right, that is enough of those angles. Today we're going to talk about where acne comes from. Let's get to it. Now, the exact pathogenesis of acne is incompletely understood, but based on what we understand now, it comes from three main different problems. Now, remember, acne is a problem with the pilosebaceous units. These are the glands that produce sebum that lubricates our skin. So, all three of these problems will all relate to problems with that pilosebaceous unit. Now, the first problem is increased keratinization and keratinization of the follicular infundibulum, as you can see here. This can lead to the development of a keratin plug that actually blocks outflow from the sebaceous gland unit. Now, something to remember, always in pathology, whenever something is blocked, that's usually not a good thing. And blockage can lead to infection and thus inflammation. And then that's why we can see those kind of red papules pop up in the skin. And yes, you just heard me say infection. Bacteria are also implicated in the pathogenesis of acne as well. Specifically, a bacteria called Propionibacterium acnes. Now, this bacteria is very special, and it actually produces an enzyme called a lipase. And what this lipase can do is it can go in the sebaceous gland, and it'll break down all that sebum. And byproducts of that breakdown will release various inflammatory mediators, which will recruit various inflammatory cells in our body, causing increased inflammation and the formation of red papules and pus that we don't like with acne. It's for this reason that there's some merit to using antibiotics to actually treat acne. That's also why benzoyl peroxide washes can also work so good for acne. It's because of their strong antimicrobial effects. And the third hit that causes acne is, in my opinion, the coolest one, and it's related to testosterone. I'm sure you remember learning at some point that taking testosterone or using steroids can result in increased acne in the user. And this is actually because our sebaceous glands have androgen receptors. In other words, their activity will increase in response to exogenous androgens. This is part of why sebaceous gland activity ramps up in puberty, and that's what gives us all acne when we're young. For reasons that aren't exactly clear, isoretinoin, or vitamin A, and its derivatives have actually shown to have strong anti-sebaceous gland activity and can kind of counteract this effect. I hope you enjoyed learning some pathology. I don't know about you, but I'm probably going to go wash my face.